Is what can I do about dark circles? Everyone complains about dark circles. Doesn't matter if you're light-skinned or dark-skinned. But dark circles sometimes can be very difficult. The reason why is because they can be genetically based. In other words, you may have some discoloration that's just due to your gene. If you're very light-skinned, those dark circles can be more vascular. And many times we can improve on that, but maybe not completely get rid of it. If you're dark-skinned, those dark circles can be based on melanin. Now, we want to have melanin underneath our eyes and a little bit darker under our eyes because it stops reflection of light, so we get actually better vision. It's meant to be that way, but sometimes it's a little too much, and it shows us with those dark shadows that make us look tired. If there is any component at all to loss of tissue, where there's a little bit of a depression or a sulcus underneath the eye, then that's something that we potentially can change, whether it's light or dark skin. And that's because if we put a filler in that area, we actually lift the tissue up. And when you lift the tissue up, you get a different reflection of light, so it doesn't look as dark. And a good analogy of that is the moon, the craters on the moon. The craters look very, very dark when you look at them through a telescope. And that's because light doesn't reflect into them, and so it looks darker. If we made the craters flat with the rest of the surface, it would be very bright because light reflects off of that. So it's the same reason that we do fillers on the eyes when there's a sulcus and what appears to be a dark circle, and that we can actually fill it in, lift it up, make it more flat so light reflects off it and it doesn't look dark anymore. So that's one way that we can treat dark circles.